Would you compare a hammer to a screwdriver to see which is better? You obviously wouldn't, because each tool serves a specific purpose. In hair transplantation, something similar occurs when we try to face off the two donor hair extraction techniques, when in reality each technique serves a certain type of patient better than the other. And that's what we're going to talk about today. We're going to compare the FUE technique with the FUT technique, and we're going to learn that far from competing, these two techniques can actually complement each other. As a matter of fact, there's a procedure where we combine both methods on the same patient to increase the maximum donor yield. But we're going to talk about that towards the end of this video. Right now, let's start with the FUE procedure, also known as follicular unit extraction or follicular unit excision. Basically, it's a procedure done with a device like this, a micropunch. And with it, we're going to create these circular incisions around each follicular unit. The advantage to extracting hair in this manner is that you won't produce a linear scar. So the patients will continue to use their hair short if that's their preferred hairstyle, and they won't have any risk of somebody noticing some strange scar on the back of their scalp. Now, the disadvantage to this technique is that in the long run, if you go really bald, if you require more than 2 sessions, you're not going to get as much high quality hair as you would with the other method. The reason for this is that there's a sweet spot right in the middle in the back of your scalp where you feel this bony protuberance, this bony prominence, and right about that area is where you have more quality hair, and it's hair that'll last basically throughout your whole life. And that's the area that we want to get to. But if you require a lot of grafts, little by little, we're going to have to stray from that area. And we're going to have to go down here towards the lower fringe or up around the crown, and the hair from those areas may not be that stable. So that's something to consider. With the other technique, with the FUT or the traditional extraction method or strip surgery, whichever way you want to call it, with this method, pretty much the opposite happens. We're actually going to focus in on that sweet spot. We're going to try to get the most of that high quality, long lasting hair. So that's a big advantage. However, it will produce a linear scar. And there's a lot of ways to soften or hide that scar, but we can't guarantee that it will be completely invisible. So this technique is ideal for those patients who don't care so much about a short hairstyle, who never envision themselves using their hair in a military style haircut. So that's something to consider. So a quick summary. FUE is ideal for those patients with smaller bald areas. I'm talking about a class 2, a class 3 on the Norwood hair loss scale. Patients who won't require so many grafts over their lifetime. And it's ideal for patients who want to use their hair really short, who don't want to worry at all about scarring in the back of their head. Now, the FUT procedure, at a glance, is ideal for those patients with larger bald areas, or patients who have a strong family history of baldness, patients who think they could go very bald in the future. Now, from all that I've said, you could probably gather that FUE has an advantage. And that advantage would be that it just doesn't seem like a surgery. The incisions are so superficial that you don't even require a suture. So those extractions, those orifices that we produce, they're going to heal on their own in a matter of 4 or 5 days. And you're going to want to get back to your activities in a very short time frame. So in general, it's just a more comfortable procedure. However, there's one more piece of information that you need to have moving forward whenever you inquire about this, and obviously before you take your decision. And that is that FUE requires 2, 3, or 4 more hours at least to complete. And the reason is that you're going to be either on your stomach or lying on your side as we finish doing every last extraction. You see, we can't start planning until we've taken every single last graft. So it's going to take longer to do this procedure, this type of procedure, and it's going to be reflected in the cost of your hair transplant. And that's something to consider, especially if the scar is something that you've never ever worried about. And one last thing, most of the clinics that would say FUE is the only procedure or it's the best procedure usually only practice one procedure. They usually only know how to do one procedure. And the reason is simple. A lot of these clinics, a lot of these doctors are fairly new to the field. They haven't been around for more than 5 to 8 years, which is when FUE became pretty popular. And so they didn't have the chance to learn the other technique. And maybe they ignore the advantages to that technique. And obviously some of these clinics are franchise clinics, and franchise clinics usually have a salesperson offering that initial consultation. So if you're seen by a salesman in a consult, he's not going to tell you, he's going to omit the advantages to the other technique. And obviously for them, FUE is so much easier to promote because you're dealing with a method that just doesn't seem like surgery. And I get that, and it's the reason why FUE in the world today is practiced in 60% of the patients, whereas FUT is practiced in only 30% of the patients. But like I said in the beginning, neither technique, in our opinion, is better than the other. As a matter of fact, there are some cases where we combine both methods in the same procedure on the same day to maximize the donor hair yield. And sometimes it's the only way you're going to cover these large 4 or 5 or 6 or 7 grade hair loss cases. And it's called the hybrid technique. But we're going to talk about that in the next video.